I am Lindsay Thompson. I'm a pediatrician here at the University of Florida. We are physically in the Children's Medical Services building, which is one of 4 pediatric primary care clinics. And I'm here with Dr. Melissa Bright.
I'm a developmental psychologist, and I work in the Anita Zucker Center for Excellence in Early Childhood Studies in the UF College of Ed. So in this study, we are looking at the association between adverse childhood experiences, so things like having a caregiver with a substance abuse problem, a caregiver who spent time in jail, or a caregiver with a mental illness, and the association with various health conditions, so both physical conditions, mental conditions, and developmental progress, things like learning disabilities. And why this study is unique is because to be able to look at conditions in each of those domains, you have to have a fairly large sample. And we were able to use the National Survey of Children's Health to examine about 15 conditions across those domains for children aged 2 to 5. So it was really a unique opportunity to be able to examine that question.
So we know that children, when they experience adversity in their home environment or their neighborhood environment, it doesn't just affect one aspect of their life. It affects their mental health, their physical health, and their development. So that this is an exciting opportunity to bring all those areas together, as opposed to just treating one problem with one answer. It's much higher level thinking.
I think to be able to communicate across those sectors as well. So we know now from this study that it's important for the pediatrician to be talking to the preschool teacher, to be talking to the family counselor, because a child experiencing adversity is demonstrating problems in each of those arenas, in the classroom, in the clinic, things like that.
So as a general pediatrician, we see children like this all the time, and it's something that we've had a hunch about. We knew that this was happening for children if their environment was toxic in any way to them, but we haven't had data or tools to help guide them. If we're able to bring together all of these groups, not just the medical setting, but bring it together with the preschool setting, with the developmental setting, with the home environment, and we could make a trauma-informed care actually happen for this child, we can change the trajectory, not only of early onset of problems, as this paper shows, but childhood adversity is well documented to also cause lifelong acceleration of adult morbidity and mortality. And to me, that would be very exciting.
So the next steps in this line of research, first we want to be able to have a tool for pediatricians to be able to identify these adverse experiences, and we need for them to be able to do it efficiently but also feel comfortable with the questions that they're asking, because it is quite sensitive. The second line of research that we're working on is actually seeing how early can we identify these experiences and address them. So if we know that some of these experiences are happening in the first couple of years and that we're seeing the adverse health outcomes very early, potentially we can identify the risk during the prenatal period and start to implement services then before the baby's even born.